better. Sorry. So my name is Ben Ngundu. I'm the head of service for the area teams, adults here in Worcestershire. So we were asked to come and discuss, or rather present, in terms of our process when we are working with individuals where their finances are depleting to be below what we consider to be the threshold. So during this session, we'll cover the definition in terms of what is it that we mean when we say somebody is self-funding, and we also going to apply the underpinning legislation, which is the correct in terms of what it says for people who are self-funding and the responsibility for the local authority when we end up sort of picking the funding for those who are under the threshold. We'll also talk about other means in terms of the financial means. So that will sort of look at those who got properties in terms of the deferred payment, which is another process that we apply. And then generally looking at the national context regarding the approach to financial assessment for those who are, again, self-funding pickup. And then towards the end, going to just quickly summarize in terms of our approach to those who are self-funding. So I think before I start, I would just want to know who is our audience, and also just to make it clear that I'm not going to be able to discuss any individual cases for confidentiality purposes. So this is really just about highlighting the process that we use here in Worcestershire. Yeah, thank you. So as I did mention, I think it's really important that we understand what do we mean when you say somebody is self-funding from the legislation's point of view. So the current financial threshold, which is set by the government, is for anyone who's got 23,250 is considered to be under the capital, which is the again the threshold that's been set by the government, and therefore they will be expected to pay the full cost of their care. So it could be 23,250, or if it's joined, then that would be 46,500. So that is the expectation at the moment from what has been set up by the government. So below the limit, is a person can ask for means tested support from the local authority. So this approach is really just from the financial point of view. Let's go next. Next, please.
Your next slide's up, Ben.
Okay, thank you. So, so what does the correct say? So the correct 2014, which is again the legislation that we use in adult social care, clearly states that self-funders are entitled to receive a needs assessment and a financial assessment, which is means tested by the council to determine the support required and to check if a person qualifies for any financial support. So the Care Act also places a duty on councils to provide advice, information, and therefore self-funders should receive this if required in advance of arranging independent care and support. They are in They are then able to choose a care home and enter a private arrangement, which can mean they have a wider choice of provision to choose from. It should be noted that many self-funders make such decisions without any input from the council and choose homes which are more expensive than the rates set by the council. So what we are saying here is that regardless of your financial status, you can still access the local authority to have a financial to have the needs assessment. So that will also help you in terms of being provided information and guidance, and also any support that's available. So we have obviously a range of care homes that we have contract with, and sometimes you might not be aware of the process in terms of the negotiations around that. So the idea is you can still have a needs assessment regardless of how much you have in your savings. Next, please. So other alternative funding options, this doesn't really sort of apply to everybody, but it is an option that would need to be explored, particularly for individuals who are moving into nursing homes. So if you have health needs that can be considered to be a primary need at the time, you could have what we call CHC, which is continuing health care check. So if that is positive in terms of the domains, it triggers what we call a DST, which is the decision support tool, and then that will help in terms of having it is quite health led, but you have the family, the individual themselves, and social care to discuss and establish whether that funding can come from health primarily, or it could be that it might end up as joint funding. But if you have or you meet the criteria for that CHC, it just means the amount, regardless of how much you've got in your savings or any other capital, that is funded by health. So the only difference here is if you are funded by social care is not free at the point of delivery, whereas health, it is free at the point of delivery. So if it's fully funded by health, then regardless of the funding, you will be able to get that support from health. But like I say, this is not really for everybody. It depends on the circumstances, also depending on your health at that point. And again, it is quite health led. So usually, when we look at an individual who might be, for example, in a nursing home for quite a long time, and their health have also deteriorated, and at the point when we are involved, we also tend to consider the CHC checklist just to make sure that we rule out in terms of potential funding from health. To go next. So again, some people may have the capital as in their savings above the threshold which we talked about earlier on, which is the 23,250. But on top of that, they may also have a property. So if, for example, somebody goes into a care home and they are self-funding because they got that capital above the threshold, but then their funding has gone below the threshold, which is less than 23,250, and they've got a property, there is also an option to discuss what we consider the deferred payment. So deferred payment agreement is an agreement between the person and the council, which enables the individual care home fees to be paid by the council by way of a loan, which is secured by a legal charge on their property. So again, we can find more information regarding this on Section 34 of the Care Act. As part of that, there is something called the 12 weeks disregard. So the 12 weeks disregard is usually for people who are entering into a care home, and this is the first time they are moving into a long-term care. And part of that is to give them the time to make decisions in terms of how the funding will be applied. So it could be that the individual has got a property, but they may decide that they don't want any sort of funding against the property. They want to use it for other sort of options. It could be renting, as long as it can raise that enough money to be able to pay for it. There is that option. But in the absence of any other options, then there is that bit of loan which can be secured against the property. So, at least you want to come in?
Yeah, just quickly. So if somebody is living with their spouse or partner and it's a jointly owned property, that doesn't come into the equation, does it, Ben? It's if
Yeah.
you own that property solely, or you have a second property that isn't jointly owned. And we've just got a message from Hazel about problems with CHC. We are aware that that occurs, but unfortunately we're not representing the ICB today. What happens when CHC funding ends is we receive a notification, don't we, Ben?
Yeah.
And again, our social care team would look at that person's circumstances to see, are they self-funding? Do they have the relevant amount of funds? Or if not, they will then go in and pick up that person's case from a social care perspective and conduct a full assessment. And during that time, that's when an assessment takes place, and the person will remain wherever they are until that assessment's been concluding and consideration's been given around what their future needs will be. And that could likely be that they remain where they are, but it's dealt with on a case-by-case basis. Sorry, Ben, I just thought I'd come in on that one. Has Ben gone?
Okay, thanks for that, Ali. Sorry, I had a quick agent call that was sort of interfering. So, yeah, so I think you're right in terms of there will be a consideration around the property. Sometimes the property may be disregarded depending on the circumstances. But as I was saying, the 12 weeks really will give you the opportunity to look at the options and to make that decision. But sometimes if you're already in a long-term nesting and you also have a property, then depending on the circumstance, that 12-week property disregard may not apply because you have already had a time to make that long-term decision regarding whether you want to be in long-term or not. So if we move on to the next one, please. So yeah, just looking at the national context, then the CAREX sets out the legal context that local authority must adhere to the point where a self-funding residence funds are depleting and they request financial support from their local authority. Where it is determined that the person's needs are best met in a care home, as per paragraph 8.36 of the annex, choice of accommodation and additional payments of the care and support statutory guidance says that the local authority must provide the person's preferred choice of accommodation subject to certain conditions, as well as ensuring that the person has genuine choice of accommodation. It is important to note that the local authority can take into account the cost of the care and use a term called best value. So furthermore, a person must also be able to choose alternative options, including a more expensive setting than the best value option. In circumstances where a third party, or in some cases the resident, is willing and able to pay the additional cost, which is known as a top-up. However, an additional payment must always be optional and never imposed as a result of commissioning failures, leading to a lack of choice. So what we are saying here is that where an individual could be, for example, in a care home already and they are self-funding and they've now approached the local authority to look at that self-funding pickup, the local authority will complete an assessment, and usually it will be really useful if we can be approached in such a way that maybe the money is just over the 23,250 so that there is enough time to plan for it. One that is determined that the person's care and support needs can only be met in a care home, then the social worker will work with the individual and request a brokerage search, which is the part of the best value, And when that is requested, is sharing with the individual. In most cases, the individual or the family will also ask that we need to include the existing care home, which is where the person is sort of currently residing. So our brokerage will also contact that individual or that provider and have those conversations. So, Alicia, want to come in? Yeah, on mute.
Just to add there, Ben, obviously there's a critical part before we get to that stage, and that is that as part of the care assessment, all of the risk factors to the individual, all of the things that might impact on the individual, how they would still be able to see family members, are all taken into account as part of that assessment process. And every single case is dealt with on an individual case by case process. So there may be ones who then do proceed to, well, we're going to look at a best value option for you because actually there's no reason why you can't move to an alternative location. But there will be others where it is deemed by that assessment, actually, no, this person can't move, this person needs to remain for the following reasons. And that debate is held for every single case, isn't it, Ben?
Yeah, yeah. I think I was coming to that. I think our slides just 2 slides away from this, but yeah, that's correct. Okay, so if we move on to the next one. So this is the Worcestershire County Council approach in terms of the self-funding pickup. So um, a person can request a home of choice is included, which is what I've just said in terms of once the assessment has been completed and we are now at the stage where we are contacting our brokerage to find out what's available. And so that search process is known as preferred home of choice for people who are self-funding. This is usually their current care home. So if the person is eligible to receive support from the council, best value search is conducted via our brokerage service and all options given to the person. If the person decides to use an alternative provider at a higher cost, our searches will provide a number of options. Then a third party needs to be able and willing to make an additional payment to cover the resident's costs. This additional payment is called a third party top up and represents the difference between the cost of the best value placement and the amount the chosen home charges. So, what we are saying again here is that this will be absolutely depending on the individual circumstances and all the risk assessment will needs to be completed. We just don't move the individual because of the cost. We need to make sure that the person needs can be safely met in a best value option. If we don't have a best value option, we're not asking anyone to pay the third party contributions. The only time when that is asked of is when we identify a best value option, risk assessment have been completed, and it's clear that the person can safely move into alternative care home. And again, during all that process, the individual themselves they will be involved. If they don't have any family members, we use the advocates. With the family members available, they will be involved in those discussions. So we are just not gonna make a decision that because this is too expensive, you're gonna be moving to alternative care home. So council have a duty to offer provider that accept the council's agreed funding rates, and if no such provider is available, the additional cost should not be charged to the individual. So in the event that the brokerage have done a search and the best value, there isn't any other option that's available which is considered to be best value, again, we're not going to discuss the third party contributions because first and foremost, we need to offer an option that is suitable and available to meet the person's needs safely. If we move to the next one, please. So Worcestershire have third-party care homes in area and will look out of area when it is a person's wish. So we also have sometimes we have individual who would say, um, my mom lives in Leicestershire, and so I would want my dad to be closer to that area, or I'd want my dad to be closer to where I live. We tend to consider that, and we work closely with brokerage to check in terms of the care homes in the area. And as part of ensuring that we do our risk assessment, we have a guidance around moving to alternative care homes. We work closely again with the commissioners in that area to check if there are any safeguarding concerns, particularly the care homes in those areas that have been identified by our brokerage, or if the family have already identified a care home, the same process will apply with regarding to the best value. And we'll also check to make sure that there are no any safeguarding concerns that we should be sort of concerned about before any move can take place. So people often express a clear view that they do not wish to move to an alternative, better value provider, but there is no one able or willing to fund the difference as a third party top up. So again, we've come across a lot in these situations where the family sort of adamant that their relative should not be moved to an alternative care home because sometimes the individual have settled and they've built that rapport with the provider and potentially the carers as well. But I think this is where we always try to provide that assurance regarding risk assessment in terms of moving to alternative care homes. So we always do a risk assessment, and which is what we said earlier on, that it is case by case and depending on the circumstances as well of the individual. So the difference in cost will fall on adult social care budget if that happens, and will continue at a higher cost. So the council needs to balance its responsibility as well as ensure equity of price to operate within the allocated budget. So this responsibility of ensuring that the funding available to the local authority is sufficient to meet the needs of the entire local population is recognized in the correct and support statutory guidance at paragraph 1027. So this confirms that the local authority may take in reasonable consideration its own finances, budgetary position when determining how it is going to meet the person's needs. Okay, if we go to the next one. So where there are concerns about the risks to a person transferring to another care home, as I did mention earlier on, we use a risk assessment tool to consider the impact of a move. So this risk assessment is not just a standing alone tool. We use alongside the assessments. We also consider the views of the family. We consider the views of other professionals who are also involved. We also tend to consider the views of the provider because sometimes they know the individual better. So we consider everybody's views in that to actually then reach that decision. And like I say, this is really gonna depend on an individual and how that sort of risk assessment is completed and the outcomes of that. So we will include ways of mitigating the risks identified. So we try to do that in every situation. In all circumstances, there will be an impact. So we are looking at long-term risk impact and any immediate risk in transporting the person as well. Yeah, and this is sometimes where we need the medical views in terms of if this individual was to be transported to an area, say for example, the care home has been identified in White Forest and the person lives in Malvern. So in terms of that transfer from Malvern to White Forest, what are the risks? So we are again working on predictable risk because sometimes we just don't know what's going to happen, but sometimes we can also tell that this is likely to happen. So where potential risks are identified, full consideration is given as to how the risk can be reduced or mitigated. Adult service work together with the person and their family to agree on a realistic mitigation. So we also look at the evidence presented as it could be that if risk were assessed as high to a person's health needs, then it may be we need to look at continuing healthcare check screening, which we made reference to earlier on. So where a risk assessment concludes the person can safely be moved to a better value home that can meet the person's needs, this will be the recommendation and meet the council's duties. Where a risk assessment identifies that person is unable to move, this will be presented by the social worker and considered as part of the usual funding process. So that's where we need to look at. It could be that third-party contribution now falls onto the local authority, but we need to make sure that that is evidence in terms of the assessments and also the risk assessments. Move next one, please. So I think I'm going to bring you in on this one, Liz.
Okay, there are some questions in chat as well, Ben, but I think if we go to those at the end of the presentation, so we will answer those. Have to say, we thought the focus today was about self-funding and what happens when somebody's money is no longer at the level which would require the council to become involved. However, I'm more than happy to also add into our discussion information about what we do in commissioning and also the quality assurance process. What I wanted to do is just wrap up what Ben has presented, is just give some hints and tips to anybody that is looking for care for either themselves or for someone that they represent or their family member. As Ben's already talked about, go to the Worcestershire County Council web pages and look up adult social care, and it's called the Adult's Front Door, and in there there's all sorts of really useful information for you to be able to view. That can then support you in understanding the type and level of care that somebody needs. So obviously the range of care that somebody might need to support them can start as little as somebody coming into the home to help with personal care needs, to somebody that then needs to be in a nursing facility with two carers supporting them. So it's really, key to understand as well as our intention and our strategic direction mirrors the national objective to support people to remain as independent as possible, to have person-centred care, to have choice in their care. And so where possible, we will support people to remain in their homes. And then obviously you don't just go from being in your own home to going into a nursing provision. There are other options in between that, and I'll come on to that as part of what we do within commissioning. So also, as part of that, if you on your search engine put in the Worcestershire Care Directory, that will come up with a directory of care provision that we've actually put together for you to be able to view. If you know the sort of care that you want for somebody, actually check them out via the regulator, via the Care Quality Commission, and review their ratings, their reports and their assessments. If we as a council do business with any provider who we have significant concerns about their quality for, we would have taken the action of actually restricting them to accept new placements. And so even though a private funder might approach them or another local authority or the NHS, the provider, because they've had a suspension or restriction in place, should actually say that they're unable to take a placement. But and then what I would also say is, as I've said, look at all the options that are available for your loved one or for yourself, and remember that you want the least restrictive environment for an individual. You don't want somebody to be placed in an inappropriate setting. And what we've come across with some self-funders where their money has ended is they've gone straight into a residential setting where actually they probably didn't need to be in that setting, or they've gone straight into a very expensive setting without considering whether there were other homes that would be more cost effective and that their money would have been better used. So my other advice then is visit any potential schemes or care homes to actually get a feel and a sense for them, and have that discussion and negotiation around fees. Fees are not usually set in stone. There is flexibility there if you are actually self-funding. And the other point that Ben made about when somebody's funding actually starts to reduce is the sooner we know as a council, the quicker we can come in, the quicker that Ben's social care team can become involved and support with an assessment and talk about options. We've had circumstances where we've heard sometimes 3 months after the event. And then we've also got quite irate providers because actually we have to pick up that funding at that point and pay it at whatever rate has been paid until we've actually conducted all of our assessments. And once again, would stress that it is always on a case-by-case basis. We have a panel that considers cases on a weekly basis. And I can say from my own experience this week, there was one case where money did not come into the discussion at all. The whole discussion was around the person's needs and their need to be able to have a family member, be able to visit them who also had certain needs. And the decision there was that it was in the best interest for that person to remain. However, there were other cases on discussion where we looked at the risks and said, no, this person can move. And that is around us being clear that we are discharging our duty and able to give that accountability back to the public purse for the best use of money. So that kind of wraps up what we've talked about with self-funders. Do you want to cover questions for that first, Jo, and then me talk about commissioning and QA?
Yeah, I think that would be good actually, because we do have some questions and we risk, disconnecting the questions from the presentation. So if that would be good. First of all, are there any questions from any directors? John.
I appreciate this is a very complex area. Do you know how many people we're talking about each year go through this process?
I think in terms of I can't actually give you the number right now, but we have seen an increase of people and some of the individuals would have also go via the deferred payment, and they've go but their money is almost like exhausted. Mm-hmm. And when that money is exhausted, they are coming back to the local authority. So I can't give you the figure, but if it's something that's of interest, I can go and find out, and then I can share that information with you.
Yes, that would be helpful, Ben. Thank you.
Thank you very much.
Is there a plain English guide to this on this specific issue? Because I know that there's the care directory, there's a lot of information through the website. Is there something specific that would help people who are self-funders at the moment so that they can get early advice? And are they offered an advocate when they get into this process?
So we have some fact sheets which are specific for the talk about the finances, which can be shared with the individuals. With regarding to the advocate, we have seen quite a lot of individuals are represented by the families, but where an advocate is needed, we can arrange that. I think the challenge we are also facing is that sometimes we don't get to know about the individuals who are self-funding. We only then get to know about them when their funding is approached that threshold, which was what we have said, I think, earlier on during my presentation, that even when you're self-funding, you can still access adult social care, and we can still do an assessment. So that will help in terms of identifying, for example, those who are going to need an advocate. So we can still arrange whether that is a correct advocate or whether that is an IMCA, for like an independent advocate for people who may lack capacity.
Right. So is there a way for perhaps, Ben, of talking with the providers of how they can share information at an early stage if funding is going to become difficult. You may already do that, I don't know.
Yeah, so we have regular provider forums that are open to all of our care homes. And we have had that discussion and debate, but actually they're under no obligation. Usually the care homes who do work with us on a regular basis will do that. But we have known some take somebody in knowing that they've only got 3 months worth of funding. And sometimes the difference in costing to the type of care and provision that we can procure at normal rates, as I would say, can sometimes be so different. They can be up to £500 to £700 in difference. But you know, that's not the normal. Normally we do get to know when somebody is coming to that point. And as Ben said, it's something has come to our attention because of the fact that we started to review cases on a regular basis. So I think that we'd have to go away and ask our finance colleagues if they can run a report to give us that data. What we have proposed as well is that the purchasing codes at the moment would still say that it's a long-term placement, and so we'd need our finance colleagues to be able to understand the reason that they started that placement, because it'll show as a new placement for us. We're actually about to introduce a new purchase code that actually explains that this is an interim self-funding pickup until we've actually conducted our review, and then it will go on to be long-term once we've actually concluded that process.
That's helpful. Thank you.
Thank you. I think I'm going to take the questions in the chat box first, if that's okay. Sharon says, if a couple both need care and the only funding option is a deferred payment, can they choose where they go to, even if their capital is below 23,250? As the council will get the funding back. So where you could put a charge on a property and they would get the funding back, can they go above the best value option? Or do they get, because it's how quickly they use up their own deferred payment funding, isn't it?
Yeah. So I think if the couple, they need to have obviously an assessment to start with, and if there is clear identification that their needs can only be met in a care home, and this is the first time that they are moving into a long-term care home, then there will be that 12-week disregard where they need some time to sort of make decision with regard into whether they're going to be entering into a deferred payment or not. But I think in terms of the question around whether they can choose where they can go, that also now going to depend on their capital in terms of the value of the property, for example. So if, for example, just a guess, say the property is worth I don't know 120 and it's for two individuals, so that just leaves really about 80,000. So if it leaves about 80,000 and they go into a care home that's costing say £2,000, so those are the factors that needs to be considered. So there might be some situations where yes, the individual can go and the local authority will support that, but I think it's really important to also understand that during the deferred payment up until potentially when the family are in a position to reimburse that money, it is the local authority that's paying for that care. So we still need to be using those, I guess, resources cost effectively, but certainly again depending on the individual circumstances.
Thank you. Alicia, you wanted to say something.
Yeah, and obviously if the desire is to stay together, then we would do everything we could to actually support that, and we've had a recent situation where we have done that for a couple. I think it's just understanding that we have a dedicated team within our finance team that manage all of our client contributions, but also do all of those assessments around whether a deferred payment agreement is suitable, appropriate, and will also then feed back to us what the sustainability figure would be. And it's when we have that level of data and information confirmed with us that we can actually make that decision. But certainly I know of a recent case where we did support a couple to stay together, and we don't always enforce a third party top up if the DPA has been confirmed. So again, you know, it is on a case-by-case basis.
Thank you. Another question from the public, from Anne. There is increasing evidence around the general risk of death of older people after moving homes. How is this considered as part of a risk assessment when a potential move to a best value provider from a more expensive one is proposed?
Should I take that one, Liz, or do you want me to? Okay, so I think we currently have what we consider the panel, where we discuss and the social worker will present a case. So when we are moving a person to alternative care home, we have a risk assessment that needs to be completed. The panel is not just about discussing the funding; it's also about discussing the suitability of the care home that's been identified. And part of that panel, we have commissioners and we have our brokerage as well. They have quite a lot of information about the care homes. And if there are particular concerns that we need to be aware of, again, that information is shared during that process. So I would say we have a robust risk assessment approach. But I think it's quite difficult to sort of understand out of the individuals who have been moved to alternative care homes in Worcestershire, how many of those have ended up sort of, passed away as a result of the move or directly as a result of that move. But I think we have a risk assessment in place at the moment.
Thank you. Alicia, did you want to add to that?
Yeah, so if somebody, for example, is considered to be at end of life, that would be something that we would absolutely take into account. We look at somebody's vulnerability, we look at somebody's age. So we recently had a case, and obviously I can't go into individual details because that's just inappropriate. Yeah. But we had a case of a 96-year-old, and you know that person remained in their setting. So you know, we look at all of these risk factors, but we still do have to balance that against, well, actually, if we can mitigate the risk and it's appropriate, and we've looked at all the vulnerabilities, otherwise we'd never be in a position to be able to move anybody, and we would be then almost held to some significantly expensive fees. And, you know, that's then you're looking at the equity of that. If you've got somebody that's come through straight away as a funded resident and gone through our social care assessment process and been offered a best value home, which is ultimately makes their personal budget, but somebody's chosen to place themselves in a home that's £700 more, there's an equitableness there, but it is always first and foremost about how do we meet that person's care needs appropriately, and then that's when the other factors come in.
Yeah, thank you. I think, Anne, you wanted to ask a follow-up question?
Yes, thank you. Yeah, I understand that balance and the equity. I suppose my question was specifically about, it's not necessarily an individual risk, it's this general risk that's beginning to emerge of older people moving, and that may be from their own home into a family member's home. It's not necessarily moving care homes, but there is that general risk, and how you quantify that on an individual basis. But I understand what you're saying, and I think a general comment from my perspective would be about the getting it out there that people are entitled to an assessment, because a lot of the people I work with visually impaired people, but naturally a lot of them are in an older demographic. Because of my social work background, I can tell them that they're entitled to an assessment, but most of them don't realise this. And I think there's a really important piece of work to do there about getting it out in the general public so that they're in the system at the beginning and getting that advice, and it's a more seamless thing, because I just don't think people know that when they're able to self-fund, that they're also able to have a statutory assessment that, you know, and reviews of their needs and so on. So I think that's a really important piece of work.
There's through the website for the adult social care front door, they're looking to launch some interactive tools called Better Care. And again, that's designed for people to be able to, who are able or representing another, to go through and gain more information and also be signposted and directed appropriately. But I would absolutely agree with what you're saying. We know that Age UK do some really useful information. We work closely with our Carers Association as well, with WACS, to make sure that they are able to communicate. But yeah, absolutely agree, and it is something that we are reviewing and trying to endeavour that is there on our opening web pages.
Absolutely, and I think, you know, it's benefiting the individual and does benefit the local authority as well. So I think we have also started sending some information in the GP. So when people are going to the GP to see the GP, the information is available. So yeah, we are trying to sort of, you know, communicate that so that, you know, people are aware that that option is available.
Thank you very much. I think there's a sort of, it's a question that follows the same theme from Hazel. So she would be interested to see how many social care assessments take place when people are in a position to self-fund. I hear regularly that people in this position are refused an assessment despite the legislation. If they were completed, you would automatically have advance notice of them running out of funding. Do you know of people being refused care assessments if they're self-funding?
I am not aware of any people being refused because the Care Act clearly says anyone can have or anyone can request an assessment. So regardless of their financial status, and at the time, if they are requesting an assessment, we wouldn't know that they are self-funding anyway. So I think if we got any cases like that, then I think there is sort of channels that we can use to address that, which could be people can contact the local authority and actually clearly report that, you know, I've been denied or refused an assessment. But like I say, I'm not aware of that. What I'm aware of is that at the moment we obviously have a backlog in terms of people waiting to be allocated, and sometimes people can wait for a little bit longer before they can be allocated a social worker. But equally, for people whose funding have gone below the threshold and they've contacted the local authority already, we always consider and look at whether that can be backdated in terms of the funding from the date when the referral was made or from the date when the assessment was completed, whichever way is closer. So I wouldn't really say we deny people to have an assessment because they are self-funding. But I think it's worth looking into that, because if that is happening, then I think we just need to get to the bottom of that.
Yeah, thank you. Does anybody have any further questions about self-funding? Okay, thank you. So there is something about the communication here, isn't there? I mean, I know you're going to work with the GPs and WAC and everything like that.
Jo, Hazel had a follow-up question, I think, and there's also another question in the chat.
Yeah, she said it would be helpful to get figures in regard to the assessment process. Do they gather the data? As many people who self-refer to care homes tell us they've been told as they're self-funding, they need to sort themselves out. But again, is this about people telling them?
Well, Ben can go and have a look at that to see what's coming through, and if that is the case, if there are examples that can be shared with us, then we will actually pick that up and make sure that that's communicated to our whole social work force around. But it would actually be at the adults' front door, wouldn't it, Ben?
Yeah. So if people have an issue, they need to ring the adult front door and tell them that they've asked for this and it's not happened. It's just, I suppose, the process really that people would go to alert you to the fact that they've tried to do it and they haven't been able to.
Yeah. Well, if you know of any experiences, you can share those direct with Ben. If somebody goes through the adult's front door and still gets advised the same, I would then advise that they put a formal complaint in, because then that would actually get picked up. But I wouldn't be aware of which assessments are coming through, because that's it would definitely be under the adult's front door and for Ben's service.
Yeah, okay. And then I think there's a final question from Sharon about how do you refund a person funding back to a date an assessment happened? How do you refund a person's funding? Yes, because you said
okay.
if it, yeah. So
okay.
I think that's
so usually the individual would be self-funding, say for example in a care home, and then they'll contact us to say the funding is now gone below the threshold. At that time, they will have a financial assessment to determine how much they need to contribute towards that. So from the date when we establish that this is now confirmed that local authority will be supporting financially, the individual still needs to make a contribution towards it. But anything that's the balance from that date that we confirm, then the person can get a credit note.
Or if they've been paying the care home, usually what happens is a person will actually stop paying for their care if they've no longer got the funding, because they haven't got the money to pay for it. But if there is a circumstance where they've somehow managed to get the money together from family members to continue, and they've continued to do that, if we've agreed a date from which we will start paying that care home, the original agreement was between the person and the care home, so they would need to approach the care home to have that refund from them if they've actually paid it directly to the care home.
Right, thank you. And then we have a question from Melanie, who works for a provider, about when a person gets an agreed deferred payment, how long would you expect the care provider to wait for the purchase order to be placed on the portal? That's a very specific process.
I don't know. Over to you, Ben, because that's an operational matter.
Sorry, I didn't quite get the question.
So when a person gets an agreed deferred payment,
yeah,
how long would you expect the care provider to wait for the purchase order to be placed on the portal?
It shouldn't take long, because once the deferred payment has been agreed, it is a responsibility of the local authority to pay that money and to pay that on gross. So the same way we would commission any other, for example, people who are not self-funding or who don't have any properties, is the same way we should be able to put it on the system.
So it should follow your normal payment guidelines, really?
Yeah.
Okay, thank you very much. So you think 3 months is a long time?
Yes, and if there is a top-up to be paid as well, we actually, it's not between the provider and the individual to pay that top-up. We actually process that as part of our payment, and we collect that back from the individual as well.
Thank you very much. Okay, are there any other questions on self-funding, John?
Yeah, if I may, Joe. Just wondered if there's an appeals process, if people are unhappy with the decisions that were made, how do they go about that?
Yes, we have an appeal process, and we've actually been reviewing this because we have realized that instead of making an appeal, people tend to come via a complaint process. So we are actually just looking at how that can be communicated so that people know that they have an option to appeal, particularly when they don't agree with the outcome of the assessment or the support plan or the budget that's been allocated. So we have an appeal process in place here, but I think it's not sort of very popular because, like I say, we get quite a lot of complaints rather than an appeal.
Sure. So that's something that will be publicised in due course, is it, Ben?
Yeah.
Yeah, that's great. Thank you.
And during the appeals process, do people then stay where they are? And what happens about the funding? Sorry, that was just something that popped into my head.
During the appeal process, usually it's because the person has not moved yet, they would have appealed the decision. So whilst we are trying to establish that, up until we can get a resolution, we're not moving the person. So they will be, still in the, if they are in the care home, they will be still in the care home.
Yeah, we cannot just arbitrarily say
no.
Let's just move somebody because and know that they're appealing. this is where our social care practitioners will work really closely with family to support for them to come to that agreement and a mutual agreement. The only time we move people from a care setting is if they are at risk, if we feel that their needs are not being safely met, if CQC have come in and said, what are you doing, council, and actually we're about to remove the registration for this home, that is the only circumstance in which we would rapidly move somebody from a care home. But again, we would still have to go through whatever appropriate care assessment and risk assessment process is needed to source an alternative option for them.
Thank you. Margaret, you had a question.
Yeah, I just wanted to go back to the written information bit. Ben, I think you and Liz mentioned that there are fact sheets around funding for people, but I'm just wondering if there is an explanation of this process. So I'm also thinking about what Liz was saying about trying to identify people earlier on before they reach the financial threshold. So whether there is just a kind of as easy as possible guide that says, when you get to this position, or when you're thinking about a care home, this is what will happen. We will need to do a needs assessment. Here's a little link where you can find out more about what a needs assessment is. That will be then put in writing and you can contribute to that needs assessment. We'll also do a risk assessment. These are the sorts of things we look at in a risk assessment. These are the sorts of questions that you can ask us, So I'm just thinking from a point of view of somebody who is on the receiving end of all of this, it's just quite a complicated process, and it's a difficult time for people, and there's a lot of concern and emotion involved. I'm just thinking, sort of step-by-step guide so that everybody knows what ought to happen and where they can fit into that. Is something like that currently available, or is that something that maybe the local authority could think about developing?
On the actual web page, if you go into the search engine for adult social care, there is the customer journey, and that's broken down into steps. I'm just looking to see the level of detail that it goes into, but it's called Journey Through Adult Social Care, and it talks about discussing your needs, care and support planning, advice from the adults front door team. I just need to understand whether we've got that step in around funding, or whether that actually needs to be added in. So this, obviously, I think this journey was added about last year, and we're constantly reviewing the web pages. So I think, Ben, that's something that we can take back and come back to you with feedback on as to what's currently there and what we would propose to actually put in.
Thank you. And somebody's put in the chat, are these things offered in alternative communication options? Which from Healthwatch point of view is a very fair question. It's something that we get challenged with a lot, is about emphasis on online and having things available in different formats. So when you're looking into this, could you look into that, please, about how people who can't access web easily could get hold of that information? Thank you.
Yeah, sure.
You're on mute, Joe.
Margaret, have you got your hand up historically? Sorry. Yes. Have we got any further questions? So I was going to have a coughing fit, so I went on mute. Yeah. So shall we move on from self-funding, and you're going to talk a bit about commissioning and quality?
Absolutely. I mean, I'll give you a very quick whistle-stop tour of it, and I'm more than happy to come back to another board if you want more details. But Ben's presented the information previously, because obviously Ben is the head of service with responsibility over our area social work response, and that's where our social care practitioners all fit in, and it's the operational response. Where I fit in from commissioning, there's a team of people working within commissioning, and we are the ones that will do that strategic background overview of actually what is it that we need to have in place to support those social care needs of people. What is it that we need in terms of external market, care services, resources? How do we need to work with the voluntary sector? So within the team that I work with, I have other officers that also do a similar role. So my role focuses on older people's care homes and quality assurance, but we also have other leads focusing on other things. But as I've referred to earlier, it's from that point of somebody being in their home and needing a social care support, like domiciliary care, or maybe some help to engage in the community, daycare services, community activities, right up to extra care provision, up to care homes and nursing homes. And as part of that as well, we work with the Carers Association. We also ensure appropriate independent advocacy is in place, and we support the team that look at direct payments, and we work with the voluntary sector around whether there are any opportunities for co-production when we're looking at services. So certainly, because we have a learning disabilities partnership board, an autism strategy, and whenever we're looking at services or changes to service, we ensure that we engage with people who are representing those communities, or actually are people with a service user or a person who's experiencing the neurodiversity or the care area that we're looking at, to give their feedback in. And from that, then we look at what we need in the market. And so we have what's called a market sustainability plan. And we also have a commissioning strategy that spans a 5-year period that says, from our public health colleagues who do all of our needs assessments, and we can look at the population, what do we think is needed going forward? What have people said to us is needed going forward? What are people's choices? And you know, what's new technology talking about in terms of any changes? And from that, we start looking at what services we need in place. So where I fit into the work that Ben does is, we have in Worcestershire County Council over 180 care homes across the 6 districts. And of those, we have 131 that support the needs of older people. We have a contract with all of those providers, but some may only have one person who's funded by the council. It may be because they were a deferred payment or a self-funding pickup, or somebody who was on CHC. And then we'll have others that we do a lot of business with. But we traditionally, up until last April, everything was spot purchase. So we had a contract and a specification in place, but everything was contracted on a spot purchase. And what that meant then was that our rates weren't actually knowable. We couldn't determine or predict what they would be, because we were actually going to the market each time. And when we talk about brokerage, that's the team of people that will actually have that contact with our providers to negotiate with them, and to understand, one, if they can support an individual, and two, what costs they would be coming in at. So one of the things that we've done for older people is that we've now got a dynamic purchasing system in place that started in April last year, which is open to any care home provider who wishes to be party to it, as long as they are not under any quality concerns process or rated inadequate. They have to go through an assurance process with our commercial team, but by joining, they're agreeing to work to defined levels of care, which are standard care, care with dementia, or higher needs care. They also identify whether they can provide long-term care, replacement care, or emergency care, so that we know which providers we can contact. And from that, then, once they're on the DPS, we try and aim for all of our placements that are going to be funded to go through that DPS process for the providers to come back. But as Ben has said, if there is a preference for a home that isn't part of the dynamic purchasing system, they also get included in that search. When we started, we had 23 providers come forward. We now are on track to have 70. We currently have 68, which is actually, I think, a significant number. out of the market, given that at this moment in time, of those 131 care homes, there's a tool called the National Capacity Tracker that NHS England produce on behalf of councils and the NHS, and I can see how many placements are occupied in each care home, and from that I can then work out how many people we've got placed in care homes. So out of all of the care homes in Worcestershire and their occupied beds, Worcestershire County Council funds 42% of those placements. So 58%, it might be 50, it might be 43, but 58% of those placements then are being made up by either self-funders, people who've been placed from outside of the area, from other local authorities, or from the NHS via CHC placements. And we don't actually have any way of determining that quantity in terms of that detail. We just know overall that it's 53 to 52% of the market. So when you look at it in that context, we don't purchase from every single home in great number, but we do have now a dynamic purchasing system where there are rates that are capped. Providers who are able to meet need come in, and they obviously, it's a competitive secret process. We don't put that out to people to understand what providers have bidded, to actually say what they're able to, whether they're able to meet needs, and two, at what cost. That then goes back to the social worker for them to review. What we also enable then is we are quite open to, if there's a preferred home of choice that's willing to negotiate as well and actually come down in price, that negotiation also takes place as well. So that's what we do in commissioning. We work really closely with providers. We ensure that they have a contract, that they have a specification. It's a protection for our residents. It's a protection for us as a council. And then what we also have within quality, within commissioning, and I actually have the oversight of, is a quality assurance team that's dedicated to ensuring the quality of all of our care provision, which is no small task. I mean, I've mentioned there's 180 care homes, there's over 200 supported living schemes. We have at the moment probably 150 home care providers, and all of those regulated services are quality assured. We look at it from a risk basis. We gain intelligence from people that send us emails with concerns, or if we have safeguardings, or if we receive whistleblowings, or CQC get in touch, and we have a really close relationship with CQC to then go and support that care home. And what we have is a very robust monitoring tool. We have officers that will go out and visit schemes or offices of providers that provide community services, to go through all of the areas that we expect assurance on. If we are not happy with the level of assurance that we gain, we will then rate a home internally as to whether it is low level concern, moderate risk, or high risk. And at the ultimate, because our powers as a council are, we can end the contract, we can move a person, we can actually move all of our residents if we want to. So that those are the other end of the scope when it's really emergency. But we like to have an approach where we work with providers to improve, and it's continuous support for them. How we work with CQC, we are different to CQC. CQC is the regulator, can go in and close a home overnight if they so desire, but they also don't go in with the frequency in which we would be visiting a care home, because they just don't have the capacity to do that. But we do have a regular monthly meeting with CQC and our safeguarding leads and our NHS quality assurance officers, because when we look at nursing provision, we also jointly visit those homes with our NHS colleagues. And that's in a nutshell how we ensure quality. And when we are aware that there are issues with a provider, we will act in response. We will make sure that social workers from Ben's service go out and review and ensure safety. But as I've said, I'm more than happy to come back and give a proper full presentation if you'd like me to at a future point.